Hello, my name is SCHARFF RETHFELDT. I'm a professor of speech and language therapy in Bremen, Germany. My presentation focuses on the use and limitations of developmental language disorder, DLD terminology, and criteria in cross-cultural contexts and its implications for access to speech language therapy services, practice, and research. I will give an overall introduction to the relevance of terminology and then take the German DLD terminology as a case study to show that the use of the same diagnostic label can have different meanings. When speaking about the use of the same diagnostic label, I actually refer to the use of consistent terminology. The use of consistent terminology helps to avert potential ambiguities or misconceptions and consequently to communicate and collaborate more effectively also across languages and systems. Using inconsistent and inaccurate terminology has a significant impact not only on our speech and language therapy, the SLT profession, but also on the people who need our services. Inconsistent terminology, and that includes inadequately translated terminology, may contribute to lack of understanding of a disorder and disability and its implications in terms of the ICF on the quality of life of individuals and their families. It also is difficult to identify and establish a prevalence, to derive criteria for access to SLT service provision, to determine adequate assessment practices and methods, and consequently best treatment practices. More, it is difficult to prove impact of therapeutic approaches and to conduct research. In summary, inconsistent and inadequately translated terminology may lead to difficulties in implementing evidence-based practice. As Regina Walsh and the International Group on Terminology Frameworks, Communication Science and Disorders put it, there is more to a term than its scientific definition. We need to reflect that these users use a term for a purpose because there is a need to use it. And we need to reflect that we may find it appealing and from a professional view, find it absolutely necessary and appropriate to use standardized terminology with the objective to speak a common language, to share a common symbol of representations for a certain disorder, such as developmental language disorder. However, reality shows us that this objective may actually fail in practice, in reality. And this can often be discovered in two ways. First, in that we share and discuss what we understand when we use a term, and second, in that we observe its impact in practice. Even with the same profession, within the same profession, we may use an identical term, but apply it differently according to the settings we work in and according to the language we speak. That is why we need to bear in mind that not only the professionals in the communication sciences and disorders, but also other people are users of terminology, like caregivers. To give an example, in 2015, the multi-SLI project demonstrated quite well that terminology has an impact for families and those affected by, at that time, specific language impairment. The participants hailed from 7 European countries and were mainly speech and language therapists, specialized teachers, and researchers. Parents had also been invited to participate in this project. The aim of the project was to address the challenges encountered by multidisciplinary teams when managing multilingual children with language impairment. The main finding was that all participating countries faced similar challenges with multiple, considerably varying terminology, in addition to differences in health and educational systems, and confirmed that the term specific language impairment was primarily used by researchers a term that excluded many of the children with language impairment routinely seen by practitioners. As a result, all participants agreed to opt for the term language disorder to allow also bilingual binational families to benefit from consistent terminology when depending on access to SLT service provision. Similar, Abels put in her introduction, summing up that this variability is contributing to a lack of equity of access to services. Interestingly, the DSM-5 excluded SLI, but uses language disorder instead. It was to expect that the ICD-11 wouldn't use the term either. And following a tremendous Delphi study, the CATALISE consortium then published recommendations by English-speaking professionals on diagnostic criteria and terminology that have received worldwide awareness and led to a more prominent use of the label DLD in the scientific literature. However, even consistent use of the label DLD does neither mean that the term has been adequately translated into other languages yet, nor that the systems have adapted nomenclature accordingly. The CATALISE consensus on DLD criteria and terminology has been echoed and discussed internationally in different languages across the globe, such as Canada, Sweden, and the Latin Americas. Today, I will refer to the German case only. Before CATALISE and up to current clinical reality, there was no broader category in German such as speech, language, and communication needs. A similar term in German has been used before, but not as a nesting category. Despite using this appealing category, there is a little semantic difference. Auffälligkeiten literally means conspicuousness in the sense of prominent features, which is quite different to focusing the needs, as the latter term encompasses a call for action and maybe even a reason to have access to support. Whereas the statement that there are features that are different from a norm may not imply any impact at all. Let's have a look at another term, language disorder. The CATALISE panel agreed on the language disorder term to refer to children with difficulties that create obstacles to communication or learning in everyday life, and where we know, based on research, that those children are unlikely to catch up spontaneously. Now, Sprachstörung in German is the term that exactly matches the term language disorder. Similar to an association with a biomedical condition, there is a small difference when referring to a comorbidity. There is also an exact match for DLD, even though the word order in SES is literally LDD, language developmental disorder. Despite all these nearly perfect matches, there remains an issue that has a considerable impact on the use of DLD terminology in German-speaking countries, and that may also have an impact on professionals in other countries, in those cases when you may read research that was conducted in Germany but published in English. And that is that DLD in the German nomenclature has been considered and still is, according to the outcome of the German Delphi project, an umbrella term. So as a result, in Germany, for instance, professionals would refer to children as having DLD, even when the language disorder is associated with a known biomedical condition or comorbidity, such as a genetic condition like Down syndrome, brain injury, or autism spectrum disorder. The current Delphi consensus study even highlighted that there is a majority of professionals who will keep DLD as an umbrella term, not using the equivalent to language disorder, that is Sprachstörung. Different to the recommendations of the CATALISE panel, it is also suggested to differentiate between DLD with and DLD without a biological condition or comorbidity. This comparison demonstrates quite well that even the same diagnostic label of DLD may be applied and may be used, and even though there may be an adequate matching term, it is not about translation only, or whether there is an equivalent term at hand. It is rather about the diverse reception of criteria-based categories that will lead to the outcome that the meaning of DLD versus LD may be totally different, even though this is also likely to account for diagnostic criteria like nonverbal cognitive abilities or age. While the CATALISE panel's DLD terminology doesn't require a mismatch between verbal and nonverbal ability, the German label DLD without comorbidity requires so. To conclude, even though there may be proper translations, they may be misleading and confusing, as the use and meaning of the same term may be different. To conclude, from an international perspective, the term DLD and its underlying definitions are unstable and ambiguous, not only when we think about the use of terminology as used by clinicians and educators. This may negatively impact the utility as identifier for access to SLT service provision, especially in bilingual and/or binational contexts. For example, when bilingual caregivers are searching the internet for more information, or when researchers are searching studies published in different languages and/or from different countries, lack of agreement about criteria and terminology has an impact on access to services. More, it may hinder research and hinder practice. That is, an alternative definition or circumscription may negatively impact the use of DLD as an effective term for searching, retrieving, comparing, and integrating research information into practice. That is why all professionals, clinicians, and researchers need to be aware and need to pay attention to the consequences of the deviant use of DLD as a diagnostic label, and that samples may not represent same entities. This example may once more emphasize that researchers always need to carefully describe their DLD definition and subject description. This especially accounts for systematic reviews. So, thank you for listening. Here's some of the literature I refer to. And if you want to stay in touch, here are the contact details. Thank you.